I'm Dr Christos Apostolou. I'm an upper gastrointestinal, pancreatic and liver surgeon working at the Sydney Adventist Hospital. Gallstones are collections of cholesterol, crystals and minerals found in the gallbladder in certain patients. They may or may not be symptomatic, and really where we step in is when patients present with commonly pain or other complications related to gallstones. The incidence of gallstones, for example, in ladies over 60 years old are approximately 60% according to the literature. This may vary. They do occur more commonly later in life, but are also prevalent in men. The gallbladder's main purpose is to store bile. This is used to digest fat. We believe that perhaps as our diet has changed, it has become less important. Hence, when there's complications of gallstones, the appropriate management is to remove the gallbladder, usually through a laparoscopic manner. The buildup of gallstones is caused by a variety of reasons. The common causes are due to diet and age. A certain proportion of gallstones are caused by hemolysis, which is blood breakdown, and that can have a variety of specific causes. The majority of gallstones are essentially found incidentally. A low-fat diet can prevent the onset of gallstones to a certain degree, but is not excluded. The presentations of gallstones vary. There's a certain group of patients that have no symptoms, and that may deserve specific mention. Patients with symptoms commonly present with pain in the right upper quadrant or the right side of the abdomen or the lower chest wall. The other options are for them to present with dyspepsia, which means essentially long-term indigestion. Worsening symptoms and signs include cholecystitis, which is infection of the gallbladder, and then certain times the gallstones may travel down the bile duct and cause pancreatitis. Commonly, patients come to presentation after having investigations for other causes of chest pain, such as cardiac disease. A lot of the patients that I see have had investigations for reflux and endoscopy. Those two conditions, in other words, gallstones and reflux, can be closely related, and treating the gallbladder often can reduce the incidence or the effect of the reflux. There can definitely be an overlap in the symptoms with regards to the diagnosis of gallstones. Commonly, patients would present to, say, for an example, a busy department, like an emergency department at the Sydney Adventist Hospital, with chest pain. The first priority of the treating doctors would be to exclude a cardiac cause, which may of course be life-threatening. Subsequent to that, other specialists may get involved after appropriate investigations to detect gallstones and direct their management. The pain can be very severe. The pain can definitely warrant opioid analgesics such as morphine. It's often a colicky type pain, similar to renal stones and to a much lesser degree childbirth, even though sometimes men would like to think it's got a similar severity. It would require admission for the analgesia and then subsequent antibiotics. The problem is that one can never be sure of the exact pathology which is taking place with gallstones and trying to work through the pain. Straightforward biliary colic will ultimately settle. That's normally after 2 to 4 hours. The concern is if the patient develops vomiting at home, they can become dehydrated, and if there's cholecystitis, which is infection of the wall of the gallbladder, that requires admission and intravenous antibiotics. Otherwise, it will progress to overwhelming sepsis.